I call the member for Bowman.
Madam Deputy Speaker, the reason for today's MPI is fundamentally an issue of deceit. It comes across very rarely in politics that you have true barefaced deceit, and this is just one of those moments. And to read out the statements by the then opposition health spokesperson, the then aspiring Prime Minister, it's absolutely cut and dried. And ordinary people that don't live in this chamber or watch it every day will see the promises and the commitments made in private health to have been rock-solid guarantees. And you have erosion of that, and you have that kind of deceit where you simply turn about on what you claim before an election in order to win and then tear it down immediately after. You see it very rarely, and that's why it has to be highlighted, and it will be today. The second issue here about changing health outcomes and it being a slow process is quite right. But it wasn't this side of politics that went to the Australian people and said, we will set a deadline. We will put the line in the sand of full time, to use the football analogy, and that by June 2009 we will be taking over the health system if there are not substantial improvements. Look at the words very closely. They didn't say if there is more investment put into health, or if there is not more investment put into health, we will take over. They simply said we will fix the health system. Those blanket promises were taken very seriously by Australian voters. They trusted in a Prime Minister that we'd see a change. And now what you're witnessing today, if you're listening to this debate, is a complete shift from outcomes in health that mean so much to every Australian to inputs. And now we have a Prime Minister who is utterly focused, as more of a bureaucrat than a leader, on inputs. And it's really just trying to conceal the very fact that the health system hasn't been improved at all. We can promise that there's enormous amounts of money from billion-dollar funds, sources of which the average Australian doesn't understand, but that's not making our health better. If you go right down to my community, where we expected a change in health outcomes, what my community was promised was a new helipad on top of the hospital. That sounded great. It didn't improve the health of the local community. So they built a waiting room for the waiting room at the hospital. And that didn't improve things either. And the fundamental misunderstanding here is that inputs don't always mean improvements in outcomes. Now, in the time we have available, I'm going to touch on 5 issues. And PHI will be the main one and the final one. But let's just look at what has been an utter fixation, verging on needing medical attention, to alcopops. From this government, when it comes to health, there's been virtually no attention to anything else except alcopops. We've effectively got a minister for alcopops in this government who has abrogated any responsibility for the health system. On smoking, when there were perfectly legitimate proposals here as alternative funding measures to increase the tax by around about 3 cents a cigarette, which you would have thought the Politburo of left-wing health economists would have rallied behind, but no, they remained mute, and this government refused to accept a simple proposition that could have supported our private health system. If we move there to cataracts, and I didn't choose a life as a cataract surgeon, I chose one here. But I know that many cataract surgeons across Australia spend enormous amounts of time delivering these kind of services, making a loss in remote and rural areas. And those surgeons will tell you, if we have a government that listens, that it becomes virtually non-economical to work to perform an operation for a Medicare rebate that is less than the markup on a pair of designer spectacles and an optometrist. I mean, eventually, if you just keep trying to slash capacity and squeeze funding, there will eventually be some sort of kickback in quality. And what we have effectively, and without meaning any offence, a health minister who effectively is so far down in the caucus pecking order that it's unlikely we're ever going to get meaningful reform of health. And that's just a political reality, and that may well be Australia's lot for the next 3 years. But the greater problem here is we have a health minister who is hostage to Treasury. We've got a health minister that is selling Treasury cost-cutting messages more vigorously than any form of health reform. It seems like everything that comes through the current health minister are basically Treasury minutes to save money. Now, that's quite okay to say we have a global financial crisis, but let's make 2 points. First of all, there weren't effectively any significant means testing of stimulus payments. There was no targeting of those stimulus payments towards those who needed them most. People who didn't pay tax, disabled, the unemployed effectively missed out. So if your philosophical concern is one of looking after the battler, you'd think you'd have a concern with the stimulus payments, and you'd think that you'd have some solutions after 18 months and choosing your own deadline on performance that we could see some improvement. But I can show you every health report card that's come out in the last 18 months, and there are no significant improvements, and that is a really significant problem for the government. Just ask all of the groups, they've been asked to comment. We know from the Private Hospitals Association the impact that these changes will have. We know from the surgeons the waiting list impact that that will have. But can I just draw one attention to the changes to PHI and what it does to the poorest of Australians? And this is often so detached from the government's thinking that they do not realise that obviously when people move from private cover onto the public system, for whatever reason, number them in your thousands if you wish, those people queue up at public hospitals or they turn around and they elect to pay a much bigger gap. And this is the great challenge, Madam Deputy Speaker, of health delivery in all developed countries, is that even with insurance there's a gap. What this health ministry is doing is making those gaps for ordinary Australians chasing a cataract operation so much larger. What happens when gaps go up? The wealthy pay the gap and the poor don't. So what this health minister is doing in nickelling and diming the average Australian who's paying for their private health cover is simply guaranteeing that the wealthy can still pay for a one-off operation without paying private health care and let it be someone's grandparents, and the people who can't pay that even greater gap miss out. And the stark reality is that when you scrimp and save on Medicare rebates, the alternative to cataract surgery is blindness. The alternative is untreated morbidity. The alternative is early death. The alternative is fewer quality adjusted years. It's quite a simple equation. What we know from the report cards from the AMA is no improvement in the time this Prime Minister promised an improvement. We know there's no improvement on hospital beds. We know it's getting worse with cost-adjusted, case-adjusted separations. We know that people are waiting longer in the waiting room. We know there's juggling of waiting lists to make it look better. But I think everyone listening to this debate knows that we're not seeing the improvements that we need to. Now, I can almost imagine a conversation between the current Health Minister and the Prime Minister. It's June 2009. Where are we now with improvements in health? Well, you know, we've been really focused on the alcopop measure, and I need to remind you that was a health measure, really, remember, to reduce binge drinking. No figures on that whatsoever. We have a binge drinking problem that we had 2 or 3 years ago. We just have ordinary Australians drinking less alcopops. OK, well, we may need another reason. Well, you know, we've got a Prime Minister who's out looking for hairdryers in Afghanistan and flying around the world, sort of annoying flight attendants, and really hasn't been able to truly turn his mind to health for the last 18 months. Well, once again, he made the promise to the Australian people of significant improvements. And then finally what we have is these sort of under the cloak of secrecy and hidden in the detail of the budget are these slashes to the very promises that were made before the election. And ordinary Australians pick that up. They remember the promises. They didn't have to be listening to the radio. They know the promises and they know that they're not being kept. And for a moment to even suggest that the reason is that Australia is on the one hand performing so well in the global economic crisis and not slipping into recession, but at the same time you can't afford to deliver basic health care, it's that dishonest contrast that I think becomes obvious to the Australian people. And in answer to the Health Minister, who said, you know, I just don't see why, as a government, we should be helping people earning over $75,000 and then tapering to 120. Well, the answer to that is simple. All around the developed world, we've had one fundamental tenet in delivery of social policy. That is, we don't play with, fiddle with, we don't means test access to health. It's just one thing that we say is something we try and keep some semblance of equity. And that distributive notion upon which I thought this party was founded is actually disappearing. And sure, they can start to attack health, and the next moment they'll be means testing education, and the next moment they'll be means testing welfare even more. This is the slow and steady creep of Labor ideology successfully veneered over by the Prime Minister at last election campaign, but it's coming through. It's coming through. And I think it's a very important point to make, and it's been made in this MPI, because today marks that line in the sand. The promise made by our Prime Minister, it's a promise that hasn't been kept. So, look, in closing, as we go around the country, people will see that when there was a promise for improved health care, it hasn't happened. When there was a promise to protect PHI, we've seen thousands of families that are effectively going to be pushed off that cover, and that will have a snowballing effect. It affects people who otherwise were contributing large amounts of money out of their own pocket into health care. It affects those under $75,000 who have to pay higher rebates, and that's completely obvious. And most concerning of all to me, when it comes to access to these surgical services and waiting lists, he or she that can pay the gap will get the service, and this is not the health system anyone in this country
The member's
deserves.
time has expired.